Good morning. Welcome to the meeting of the West Sussex Health and Wellbeing Board. I'm Bob Lanza, chairing this board. Today we're at the offices of Crawley Borough Council. Just a few housekeeping points. There are no scheduled fire drills, so in the event of the alarm sounding, please leave the building via the main spiral staircase and through the main reception doors. Once outside, please turn left and make your way to the fire assembly point located beyond the multi-storey car park on Exchange Road. If you're unable to use the stairs, please wait in the council chamber and you will be guided by a member of staff to the evacuation lift. This meeting is being live streamed via Crawley Borough Council's YouTube channel, which is called CBC Digital. Please note that this is a no comments function available as part of the webcasting. The meeting is also being recorded and will then be uploaded to the council's website. Both councils and the data controller will retain the data collected during this webcast. This will be done so in accordance with the council's published data retention policy. Any members of the public seated in the public gallery should be aware that by entering the chamber, they are consenting to their image being captured by the automated camera system. Recordings will be used for webcasting and training purposes. Councillors are reminded, and everyone here is reminded, to take notice what are displayed on the screens in the room, as this shows what is being recorded and webcast. Cameras are currently set to capture you in a seated position, so please remain seated when speaking. You can request to speak by raising your hand. To speak, please press the button with the face on it and the microphone will go green when you are live. Please press the button again once you have finished speaking. Only 2 microphones can be on at a time, but sometimes it's better to even limit that to 1. We will now start the meeting. So first of all, we have apologies for absence, and Tina Favier, who has sent a substitute, Tracy Strutt, Head of Resident Services, Ada and Worthing Councils. Ian Smith, substituted for him is Monica Fletcher, Deputy Chair of Surrey Heartlands and Sussex Integrated Care Boards. We have apologies from Helen Rice, Chief Executive of Age UK West Sussex. Apologies also from Andrew Hines, and we have a substitute in Anushka Adamson Parks. She is Chief of Strategy, Planning and Performance, Surrey and Sussex Healthcare NHS Trust. Apologies from Dan Charlton. We have as a substitute Rob Szymanski, Managing Director for West Sussex Partnership NHS Foundation Trust. We also have apologies from Roxanne Smith, and substitute is Rachel Potts, Deputy Director, Strategy University Hospitals Sussex. Also apologies from Councillor Jackie Russell, Amy Gallia from the NHS, Annie Callanan, and Councillor Alison Cooper, who's Chair of the Health and Adult Social Care Scrutiny Committee. Although we have a range of apologies there, I am grateful for the efforts made to have substitutions. It's so important that every organisation is represented here. Just a few opening remarks. Welcome again to the board. As you're probably aware, the Health and Wellbeing Board's steering group has been established, and this will manage and plan key business on behalf of the Health and Wellbeing Board, including the work programme, and this will ensure that statutory responsibilities are met. The steering group's inaugural meeting took place on Monday 5th of January, and further meetings will be scheduled with the intention of meeting 3 times a year. At the West Sussex County Council full council last December, a notice of motion on online digital harm focused on smartphones in school settings was debated. Following support from county councillors, it was agreed that Councillor Jackie Russell, a Cabinet Member for Children, Young People Learning, and myself as Cabinet Member for Public Health and Wellbeing would write to the Secretary of State for Education, Bridget Phillipson MP, to request that the government reconsiders its position on this matter and that all primary school settings become smartphone free. The Council published a special edition Healthy New Year electronic newsletter in January to its 207,000 subscribers, with a lot of information on free local services to support health and wellbeing, including through West Sussex Wellbeing and other services. Topics included looking after your mental health, cutting back on alcohol, stopping smoking, weight loss support, and sexual health. An update on the delivery of the Health and Wellbeing Board strategy was also highlighted, noting that delivery groups will publish their first year action plans, including goals and measures in the near future. So that is my update. And can I now see, please, on item 2, if there are any declarations of interest? Any online? No? Thank you. Item 3, urgent matters. There are none of those. Item 4, the minutes of the Health and Wellbeing Board held on 6th of November 2025. Can I ask if we can agree the minutes of that meeting, which are on pages 5 to 14? Is that agreed? I mean, not everyone was there, I understand that. Yeah. Okay. Thank you. Then we have the actions and recommendations tracker, item 5, pages 15 to 18. And can I ask that we note that the position of the various actions and recommendations, but are there any questions also on the responses as tabled to those recommendations and actions? Can I see if there's any questions or comments on those? No? Okay, I'll take those as read. Now I'm going to make an alteration to the running order, and item 6 was to have been the Children First Board, but I'm going to bring forward instead item 8, the Adult Social Care Update, and invite Alan Sinclair to present as the Executive Director of Adult Services and Health. Alan, please.
Hopefully I pressed the right button. Yes, looks like I have. Morning everybody, Alan Sinclair, Exec Director, Adults and Health, and the Statutory Director of Adult Social Services for West Sussex. This is the first time we've done a sort of an update on adult social care, and we're going to try and make it a regular item. It will be verbal, I think, is probably what we're aiming to do, because the speed at which things are moving, by the time I've written anything, I suspect it will be out of date. So I think a verbal update, and obviously if we are able to do a written update, we'll provide that ahead of time. A number of areas to cover this morning from adult social care point of view. If I start with the refresh of the adult social care strategy. So the strategy that we've been working to, The Life You Want to Lead, is a strategy that comes to an end now, just about now, and we have been working on the refresh of that strategy, having lots of conversations with people who use services, partners, family carers, the voluntary sector and the staff across the council to work out how best we take forward the next stage of the strategy. Recognising the sort of lifetime of that strategy, depending on the outcome of local government reorganisation, may change and shift by the time we get to that point. But actually what we were trying to do was develop a strategy that could be sustainable for one that could be absorbed into either one or two unitary councils, depending on the outcome of the local government reorganisation. What it also does, the new strategy is attempting to sort of articulate the financial challenges that we are facing in relation to adult social care, the increasing demands that are coming and the increasing complexity of need, and the need for everybody. In a sense, it's not just about adult social care services in the council, it's about how do we all work together to meet the needs of people who've got adult social care needs. So a real focus on partnerships, collaboration, and co-production with people who use services. So the draft is out at the moment. Some of you will have seen that in this room. So thank you for those that have passed comments back to us. I know Lois has already done so. Thank you, Lois. That's really, really helpful. And basically what we are looking at is 5 key principles for the strategy: financial sustainability, collaboration, safeguarding and safety, reducing inequalities, and independence. So that's the principles that sit across. We're looking at 4 priorities for the strategy overall: empowerment, building relationships, getting the right help at the right time, and then how do we support people at home, and home being the priority for support for people. And in a sense, those 4 priorities build on the previous strategy, so they are obviously taken forward for the strategy overall. We've then got 4 enablers that won't surprise you all. So workforce, how do we ensure we've got the right workforce to support people with adult social care needs? Getting the best out of technology, because it's a fast, quick moving world in relation to technology. And we know that we can do more in supporting people in relation to the use of technology. How do we work with the market? So that commissioning, market shaping responsibility that councils will have, but how do we do that in a collaborative, joint way? That feels more important than ever. And then obviously the sort of use of data and insights, because although we've got lots of data, there is even more data out there and insights that we could be using that could help us identify people on their sort of journey into social care, so we grab people earlier. So the strategy is out the draft is out for comment at the moment. It goes back to the Health and Adult Social Care Scrutiny Committee at the beginning of March for a good debate in the Scrutiny Committee. Depending on the outcome of that, we're intending to take it to Cabinet a couple of weeks later for formal sign-off of the strategy. For those if people are interested and haven't seen a copy yet, happy to send that on to people. There's an opportunity to comment, but I think probably the majority of the people in the room have probably seen it already. But if people want to contact me if they've not seen it, and I can whiz that on to everybody overall. The second area I wanted to cover was obviously we've been on an adult social care improvement journey for the last 2 to 3 years. That has led us to the CQC, the Care Quality Commission inspection outcome of good. So we're really pleased that our improvement work led to the right outcome in relation to an inspection. But obviously that improvement programme comes to an end, and we're just looking at where do we prioritise our work in terms of improvement journey next. And where we are settling on is an area of work which we call in social care lifelong services for those people who've got physical disability, learning disability, or mental health issue, who have a lifelong disability in relation to those issues. We are looking to do the next improvement programme in that area. We're just starting a discovery phase at the moment, and we can come back to you when we've got some more details and information in relation to that. I probably can't talk about adult social care than talk about the budget. So the council budget is going through its rounds of approval at the moment for 26-27. The papers are all out, they're available. You can have a look at those online if you go to the council website, and you'll see from an adult social care point of view both an increase in budget, but also some savings areas, efficiencies that have been described. But overall, it is an increase in the budget. The biggest increase relates to the support to the market. And the reason I'm saying this is obviously the market for West Sussex is really critical to making sure that we deliver really good outcomes for people who've got social care needs. We've supported that market over the last few years in a really positive way, and we've earmarked a pot of money again for 26-27 to support the market in terms of an inflationary uplift to the contracts that the council has with the market overall. I think that'll probably it'll never be enough. I think it's probably the best way to describe it. So we will get challenged, I'm sure, back from providers to say it's not enough. We have that every year, but we're very pleased that the council has supported us with a further uplift to be able to support the market in 26-27. The other couple of areas I just wanted to talk through were in relation to the council's improvement programme. So the council has a connected council, a set of transformation programmes, and several of those will have a significant impact for adult social care. The main ones being there's a programme that's looking at transitions to how do we support young people as they move from children's services into adulthood, and I know our children's services are working hard in supporting to get to good fruition. There's a significant work going on around digital across the council. But clearly I'll be looking for the benefit of that to support adult social care. But the main area that I wanted to talk through was as I suppose I was talking about it in the adult social care strategy introduction, was how do we get the right help to people at the earliest possible point. So the council is investing into currently a significant piece of work around how do we do early support better for people who are on their journey into care and health needs. We've working with a partner called Newton Europe, who are working with us for the couple of months and doing a sort of diagnostic phase to identify where we can make improvements to how we support people at the earliest possible point, rather than people entering into care needs at a later and more expensive point in time. We are trying to align that, and I know Fozzie has been involved in some of the conversations as well. We're trying to align that in relation to working with partners, so working with the voluntary sector, working with their NHS colleagues, working with the district and borough councils about how do we work in a partnership way to deliver what potential improvements we could be making. Now clearly we're at a discovery diagnostic phase. We will be coming out to people with this is the view of how this might work for us overall. And then we've got some decisions to make around what that investment might look like if we think that's the right thing to be doing. So really a significant programme overall in supporting us align some of our work around prevention and early support, and clearly trying to align to the work around neighbourhood health that I'm sure our NHS colleagues will be talking about a little bit later in terms of a priority there as well. And the last area I wanted to cover was in relation to the Casey Commission. So you probably all heard a little bit about the Casey Commission. So an independent commission has been identified by government to look at how we lead an improvement in adult social care across the country. The Casey Commission is very much in exploratory listening mode. So it's started with a bit of a bang, it's gone very quiet, and we are expecting to hear some interim recommendations in the next couple of months from the Casey Commission around where does adult social care prioritise next nationally, and obviously that will be backed by government, but the main recommendations will be 2028. It's a little bit worrying that 2028 seems to be the date for lots of changes going on and includes significant change, I suspect, for adult social care, which we don't really know fully what that looks like yet. But clearly, as I hear more, I'll be able to explain to Wellbeing Board what we think that looks like and what the implications will be for West Sussex. Thank you, Chair. That was me for now. Happy to take any comments or questions. That would be helpful.
Well, thanks very much, Alan. Thorough briefing there. Can I just invite board members to ask any questions or make any comments? Anyone, please? No one online?
Oh, yes.
Ian Duke, please.
Thank you, Chair. So should probably explain actually between Adrian Worthing and ourselves, we kind of have a pre-meet with all the different reps across the districts and boroughs actually to feed into this. And one of you actually spoke to it, Alan, so thank you. But in relation to the strategy, it was a question about that emergent work you were just talking about with Newton and the links and everything, and that kind of linked into, the local community networks and the work coming out of the ICB and how that kind of comes out within the strategy, really, because I think you've kind of got some hooks in there, but it's not quite explicit coming out. So that was a question that was coming out of the group.
Yeah, thank you, Ian. And in a sense, the diagnostic work, I think, will then lead us to be more explicit, I think. I didn't want to be too explicit in the strategy because I don't really know what the outcome of that's going to be yet. But clearly we will have an action plan that sits alongside the strategy, and there we'll be able to do the more detail that aligns us to whatever the recommendations and the agreements we come out with from the diagnostic phase. Thank you.
Thank you. Any other questions or comments, please? Looking around. No? Okay, well, thanks again then, Alan. And we'll move to item 6, which is the report of the Children First Board, tabled on pages 19 to 38. And this is to be presented by Dan Ruhr. Oh, it's Colette, isn't it? It's Colette. Sorry. Yeah. Colette, yeah.
No, that's fine.
Yeah.
Thank you very much. I'm Colette Versage. I'm Service Director for Children's Social Care, and I'm representing Dan. And he gave his apologies as well. So I will talk towards the Children First Board update. I would assume people have seen that we've now have the final report for the Children and Young People's Plan that is running from 2026 to 2029. This was presented to the board on the 9th of December and it was approved with one minor change which was agreed. We also have a promotional plan in place because we've realised with the previous plan that only 27% of the community were aware of the plan. So we really wanted to make some effort to ensure that people are aware of the plan and what it consists of. As this is a partnership plan, all Children First Board members committed to using their platforms to support the promotion. We've also created the animation, which wasn't ready when we had to submit the papers for this board, but I'm quite happy to share this so that we can do that within the minutes as well. It's a 5-minute animation and it's actually quite good and give you an idea about what the plan is about. The formal launch of the plan happened on the 14th of January after the Children and Young People Scrutiny Committee last week. Information was presented on how we will monitor the impact of the new Children and Young People's Plan. This will be a mix of quantitative information as well as qualitative information, so it's not just data, it's also what do we see in respect of impact. This will also include case studies, collaborative working with partners. Planning for this work is in progress and we look forward to sharing more of this in the meeting in March. The board received presentations on progress within children's services and introduction to the Family First programme in West Sussex, which is one of the reforms that we are having to carry out as children's social care. We also had information around the early years strategy to date, and that was shared with the board as well. The engagement sessions which we have, so we have 2 sections of the board. We have a formal meeting and then we have a break and then we have young people joining the meeting and we tend to have a theme that they have to look at. The last theme was around mental health and emotional well-being, and it generated a rich discussion about challenges young people face and included excellent feedback on how schools are finding creative ways to support pupils. As a next step, we propose creating a short video showcasing examples of how young people feel well supported alongside good practice from schools. This resource can then be shared with all school leaders. There's nothing else I have to say unless people have questions for me.
Thank you, Colette. And so just we're asked to consider how we can support promotion of the new Children and Young People's Plan 2026 to 2029 and to consider if there are any specific requests Health and Wellbeing Board members would like us to consider in future reporting from the Children First Board. So I'm inviting board members to comment and ask questions. Can I see if there's any indications online? Monica Fletcher, please.
Good morning, everybody. Monica Fletcher. I'm just trying to triangulate with what you said at the beginning with your chairman's report and actually thinking how things are moving so quickly with the use of mobile phones in schools, whether that will be something on your agenda as you move forward with consulting with the children and so forth, and how we might establish the impact of any policy changes. So I think from when you obviously started this work, things have moved so rapidly. It goes back to what Alan said. We live in a very different, moving environment. So it's just trying to triangulate what you said at the beginning, Bob, and any comments on that?
Thank you, Monica. As Bob has said, our director is very closely aligned with responding in respect of these requests to the Secretary of State because we did the joint response to them. in respect of the Children First Board, we do have public health and education as part of the board members. And we do talk if there's anything about that. But I think it's a good point. It could be a theme that we get the young people involved as part of our sessions as to how they feel about that. Social media do come up quite a lot around the mental health. We had it with housing, information around children feeling safe in the community, not knowing when it is fake news. And so it is really important that we do take on board how important social media and mobile phones are for our young people in West Sussex.
A real quickie back. It's always the unintended consequences, isn't it? Because I think we all sit here and say this is, obviously wherever we sit in our personal life, in our professional life, but there are sometimes unintended consequences, and how children respond to this and how that affects their mental health. So brilliant. Thank you very much for taking that up.
Thank you. Alison Challenger, please.
Hi, and thank you, Colette, and thank you for the question. And I just want to pick up on something that Colette touched upon there, where public health are working very closely with our children's services colleagues. We have, I think it was autumn last year, where we had an event where we were actually looking at the whole issue of mobile phones in schools. So we are very much in that space. So we've got a huge opportunity with our health and wellbeing strategy. We will be having a deep dive, if you like, on that particular area of children, young people's mental health at a later board meeting. And I think we have recently heard that the government wants to consult on, obviously, the internet, the social media access for young people. So we will be considering that very carefully, and I'm sure we will be making a response from Public Health and Children's Services to that.
Thank you. Fozia Harrington, please.
Thank you. I just wanted to welcome the plan. It's a very coherent multi-agency plan, and really welcome kind of the extensive engagement that's been undertaken to develop it. It does signal quite a number of health responsibilities within it, and I just wanted to assure you around our work in health around trying to develop resilient children's community and mental health services that will really underpin some of the delivery around this. And indeed, I know that our integrated community teams and the leadership groups, children and young people, especially mental health, is really important and high on their agenda. So there may be some scope in terms of looking at how we bring those leadership groups into the conversation about the delivery and implementation of some of this. And I'd certainly welcome conversation if you haven't already got the connection into the ICB about how we can promote this.
Thank you, Fozia. And are there any other questions or comments, please? Anushka Adamson-Parks, please.
Thank you. I think building on that, I'm conscious there's quite a lot in here that absolutely is also being delivered in health, and it will be really important that we bring it together. I'm thinking some of these transitional programmes of work, particularly around health and social care, if we could do it once and do it well, that would be really good.
Thank you. And any other comments, please? No? Anything online? No? 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 Okay. I just wanted to come back briefly to the mobile phones point, because and the comment was made about unintended consequences, and in that context I just mentioned that a number of councillors in our debate in Chichester made the point that sometimes mobile phones are platforms for assistive technologies, and so anything that the government does needs to recognise that point as well. Welcome the comments from Fozia about promoting this plan, and thanks again for presenting, Colette, and standing in, and yeah, thank you very much. Thank you. So we'll now move to item 7, which is the public health update, and from Alison Challenger. Thank you.
Thank you. Morning, everybody. Another verbal update from myself. So just touching on a few things. We're We're still obviously very much in winter and still very much seeing a lot of colds, flus, infectious diseases around. I mean, we may get some update on the current position in our NHS services from colleagues later on, but I think it's still very much the message about managing to reduce your risk and protect yourself as far as possible through avoiding and washing hands and also where appropriate vaccinations. The other time in January is a time for when we make resolutions and we start to think about our health and well-being, and it's often a very busy time for some of our services around health and well-being. So on that note, promoting our Stop Smoking campaign, you'll have heard me mention quite a number of times now that we have a specialist stop smoking service that is government funded and run by the council and now operates across the whole of West Sussex. So there is free, accessible stop smoking support, which is really flexible according to the needs of the individual. And it comes along with quit aids such as nicotine replacement therapy and vapes in order to help quit. So promoting that, and we have all of the details on our website for the County Council. We've also running our own Stop Smoking campaign to promote all of that. So you may see some of those adverts going around, and it'd be really good if Health and Wellbeing Board members could help us to promote the availability, the accessibility of that. A few other things we're involved in. You may have heard of supervised toothbrushing schemes, and we are running those throughout West Sussex. Again, we've got some government funding for that for the current year, and we've heard also we'll get it for next year as well. These have proved really successful, operating throughout schools and also nurseries, and I think we've reached about 1,400 children so far, and we've got obviously another year of that as well. Along with that comes some free packs that we are going to be making available through all of our libraries and through our family hubs as well. So watch out for that campaign. You'll have also heard me mention about the work that we've been doing around sexual health, and we've conducted quite an extensive sexual health needs assessment, which we did to inform our re-procurement of sexual health services. So we are almost in a position to make that formal announcement. We have awarded a contract. We are just about to sign that, and I'll provide more details on that as we go through. But it has certainly been informed by a huge comprehensive engagement campaign that we have had to understand what people want and need from sexual health services across the whole of West Sussex. We've also got a sexual health campaign running at the moment, the Safe campaign, and it is all about raising awareness of sexual health, sexually transmitted infections, how to access support for treatment, diagnosis of sexually transmitted infections, but also the really important topic of contraception, on what's available and how you can access contraception, including the what we know as the morning after pill as well. So a lot of services, all of that detail is available on our website, and you may see it across social media as well. Of the final point, I think it was mentioned about, and I think Alan mentioned it in terms of the work that we are all doing really in terms of working at a neighbourhood level and supporting that integration between health and social care, and public health very much involved in that neighbourhood work where we are supporting our teams to understand what some of those needs are at the different neighbourhoods and some of the evidence base and ways of addressing some of those needs, looking at the health of those neighbourhoods overall. I'll stop there, thanks.
Thank you, Alison. And I just, we're asked to note this update, but are there any questions or comments, please? Just looking around the room. Nothing? I'll just mention, Alison referred to several initiatives and campaigns, and it is really very helpful if they can be amplified, particularly on social media. And it's not just a West Sussex County Council tag. There's also a tag West Sussex Public Health, where these messages go onto X, for example, and it would be great if you can amplify them Thank you. So, as there's no more questions, thank you for that update. And we'll go to item 9, which is the Safeguarding Children Annual Report on pages 39 to 96. And I think I've got here... got here Rachel, is that right? Yep. Yeah, Rachel again to present. And Rachel is the independent scrutineer for the West Sussex Safeguarding Children Partnership. Yeah.
Thank you, Chair. And I am Rachel Egan. I'm your independent scrutineer for your Safeguarding Partnership. Some people I know really well around the room, quite a few people I don't think I've met before. So I'll just tell you a little bit about me so you know something about the background of your scrutineer. My background is predominantly in children's services, commissioning, transformation and operational delivery, and responsibility for public health commissioning. And I am now independent scrutineer for a number of safeguarding partnerships, and I'm a non-executive director in the NHS. And I've been working in West Sussex with the partnership for just over a year. So I'm really pleased to bring the annual report for 24-25 today. And I think the first thing that's important for me to say is that as your scrutineer, I can give you assurance that you are meeting all of your requirements as set out in Working Together 2023. So that's a really good foundation. And really where we are now is we're in a place of leaning into thinking about maturity as a partnership and how we use both our local arrangements and our Pan-Sussex arrangements to really add value as multi-agency partners to the impact that we can have for children and young people. And you've had today the Children and Young People's Plan, and there is a lot of alignment between that plan and the current priorities of the Safeguarding Partnership. And I know there's been a lot of discussion this morning about children's mental health, and one of our priorities around children's and emotional health and well-being. To bring you up to date with where we are, because the report is very retrospective, and we've just completed a multi-agency audit around mental health and suicidal ideation. And we're really lucky in West Sussex because public health is very much embedded in the partnership arrangements, and there's very close working relationships across public health and the Safeguarding Partnership, and that really brings a huge amount of value. And all of the partners have really mobilised around those issues. And I think a couple of people have mentioned the work with schools, and I just wanted to bring that through for you in a bit more detail. We have an award-winning programme in West Sussex, which is fondly referred to as MAMET, which stands for the Multi-Agency Mental Health Education Triage Service. And I'm sure many of you know it, but we had a fantastic presentation from the officers in the council and police who lead on that piece of work and who also lead on Operation Moonlight. And Operation Moonlight and MAMET have a critical interface. When children are discussed at MAMET and they are identified as having high risk of suicidal ideation, they may have made an active suicide attempt, they have an Operation Moonlight marker put on their record. And that means that neighbourhood police can see quite a lot of information about that child's behaviours and, for example, where they are likely to be found if they go missing. And we heard about a number of examples where, through Operation Moonlight markers, children had been found after they had gone missing, and they had been prevented in making the suicide attempt that they planned. So there's lots of things in the report, very happy to take any questions, but I really just wanted to give you that example because for me, that really captures what the partnership is about. It's about thinking together, how can we work more effectively to safeguard children, improve their outcomes and improve their experiences. Thank you.
Thank you very much, Rachel, for the report and the presentation. Can I see if there are any comments or questions as a result of that? And Councillor Amanda Jupp, please.
Thank you, Chair, and thank you, Rachel. It's a very comprehensive report, 50 pages. There's an awful lot there, and it's very good, I think, from a professional point of view. But could I perhaps ask, when I was going through it, in the end, the colour and everything, it was slightly overwhelming. And, I'm sure it's aimed at professionals, and I absolutely understand that. But I still think we need to get out to the general public about safeguarding, because safeguarding is everyone's business. And I'm involved on the Adult Safeguarding Board, so I know that's slightly different. But I just think it would be good if it could perhaps be broken up a little bit, different colours, and maybe a forward from the chairman, just introducing and just reassuring people that, we're really on it, which we are. And, there's lots in there for you to continue if you want, but I just think it could be perhaps a little bit more user-friendly. Thank you.
Absolutely. I think something that is absolutely central on the priority list this year is greater involvement of children and young people. It's one of the areas for development. I agree, we are ultimately, in my view, accountable to children and families. So next year's report, there will be a young people's version, a children's version of the report, which I'm sure will be helpful, not but just for them, but for everybody. It is a really long report, and there are a couple of things to note about that. The first is that something that is really powerful and unique in West Sussex is the extent to which districts are actively contributing to the partnership. And so it's so important for them to see specific information about their contribution in that report. The other reason why it's really important for it to be rather long and inaccessible to some degree is because Ofsted, the National Panel for Children's Safeguarding, will go through that report, and they use an AI tool to search for a range of words. And if those words are not in that report, you will be put into the box of maybe not as effective or not as clear. So we have written the report partly with that in mind. So we need to cover that off, but we do also need to cover off making it accessible, and I've explained about the children's report. I think one of our big priorities is also about how we reach communities. We've got a lot of good work that happens through districts, but they are a great conduit to reaching communities, and we could be doing more in that space, and we could be doing more in the space with the voluntary sector. I think the other area where we have really been having a focus in the last 6 months is on working with our education colleagues from early years through to FE, and we have a lay member that has joined the Quality Assurance subgroup, which I chair, who has an education background. And the use of lay members and their contribution, again, is an example of maturity in partnerships. And we also have plans in this financial year to develop a young scrutineers programme.
Thank you. And can I see if there are any other questions or comments, please? And Caroline Ridley, thanks.
Hi, thanks. Yeah, really amazing report. I just had one question. The Operation Moonlight in particular sounds brilliant. I was just wondering, is that then shared across beyond West Sussex? Because like the police force is Sussex Police, so does that go through the rest of Sussex?
Yeah, it does. So it goes across the entire force, and I think. From memory, I think there are approximately 256 schools that have access to Mammoth. And I think last year we had nearly 500 children supported through that. The other element that is really important is that consultation can also be given to schools and parents, because we know that the challenge of waiting lists for mental health support is a national challenge. We're not going to overcome that easily, and this is a really effective way of making sure we're getting that support for children in a timely way. That panel meets every month, and really thinking about what are the strategies the practical strategies that we can put in place around those children that will make a difference in the short term.
Thank you. And can I see around any other comments, questions, please, online as well? No? Okay. We're asked to note the report and the progress made. Thanks again for the comprehensive report. I have to say it's a bit of a revelation that one can produce an AI-friendly report, and I hadn't realised that.
All the tricks in the
I just kind of wonder. How many other reports that we have tabled before us are in fact geared towards AI interpretation. I think it's just something to perhaps be aware of. But I think Councillor Amanda Jupp's point is important as well. As well as that version of the report, there needs to be something a little bit more accessible. I mean, I think unavoidably we have quite a complex structure here, and a lot of acronyms as well, which you've helpfully decoded. But I think another version of the report would be helpful. But that said, it's great to hear that we're meeting all the requirements that we should be, and also about the Mummet and Operation Moonlight. So thank you again. We're asked to note the report and progress made. Is that agreed? Thank you. Item 10 is the progress update on delivering the West Sussex Joint Local Health and Wellbeing Strategy 2025 to 2030, and that's tabled on pages 97 to 112. And you'll be aware that we have 5 priorities, and the kind of approach we agreed to take would be that we'd be an update. There'll be an update on broadly all of them, but as we'll see today, a slightly deeper update on one of them. Hence 5 Health and Wellbeing Board meetings each year. And we're asked to continue to work in partnership to deliver the strategy by actively engaging in the delivery groups for priority areas, and to champion this work during the 5-year period of the strategy, and to approve delivery group year 1 action plans for publication alongside the strategy to be shared virtually for approval. So I'm going to ask Danny Plowman, I think it's Alison Challenger to begin with. Yeah, sorry.
Okay, any or all of us. I'm just very briefly introduce. Just remind colleagues something you probably already know, that this is our statutory health and wellbeing strategy. As partners and with our communities, we developed this and launched it last year. It's very much a pragmatic and practical delivery approach to having a strategy, which relates to the 5 priority areas and groups that Bob has mentioned. It's about adding value to the work that we are already doing as a health and care system. And we're really pleased to bring updates to you every single time we have a Health and Wellbeing Board meeting. Today, we're trying something a little new, and the update is going to be in 2 parts. So Alison Thompson's going to give us the general update of where we are, and Danny Plowman is going to do the first of what we think will be 5 deep dives or focused approaches in terms of what is actually happening in detail in some of those groups. So Danny's going to focus on temporary accommodation for today's meeting. I'll hand over to Alison now.
Thanks very much, Alison. Yes, as you say, we're progressing really well, actually at speed with the delivery of the strategy. in this report, we have summary reports attached for each delivery group. I won't go through them now, but they're available to read. As reported previously, as I say, all the delivery groups are established, and we now have confirmation that the Managing Director for Sussex Partnership NHS Foundation Trust is chair for the Transitioning to Adulthood Children and Young People's Mental Health and Wellbeing delivery group. So really good news there. At the moment, all delivery groups are very busy finalising their year one action plans. And as Chairman said, they will be shared virtually with the board for their approval over the coming weeks. And the reason that it's virtual is that the next board meeting isn't scheduled until May. And the board is very keen that those action plans are published as soon as possible. Once the board approves those action plans, they will be published on the strategies website, and at the moment we're just designing how they might be presented. So very keen that each delivery group has their own area. You might remember that we have animation, which is the overview of the strategy, a very short 2-minute animation, and we also have animations for each delivery group priority area, so they'll also be on the website. Another couple of things to be aware of: we're delivering a communications and engagement plan for the overall strategy, and I know that some delivery groups are already thinking about their own communications and engagement plans as well. So lots of activity going on there. And I mentioned previously that we're also developing a monitoring and evaluation framework for the strategy and also for each of the delivery groups. So when I have more information on that, I'll be able to update the board, but that's something that we're progressing at the moment. So that's the update from me. I'll just pause for any questions before I hand over to Councillor Jupp, who is the chair of the Health and Wellbeing Temporary Accommodation Delivery Group. Thank you.
Councillor Amanda Jupp.
Thank you, Chair, and thank you, Ali, for that. As Ali mentioned, I'm the chairman of the Temporary Accommodation Delivery Group, and I'd just like to take this opportunity to thank everyone who is involved in this group and for their contributions so far. As you heard, well, you will know that from the papers that the first meeting was at the end of last summer, where the aims and ambitions were set out. And at the second meeting in November, it was agreed that there would be a focus on collecting relevant data, engaging with the workforce and volunteers who have first-hand experience and good knowledge of temporary accommodation, whilst improving access to support and transition to permanent housing. So there's lots to do. Our next meeting is at the end of February, and we look forward to coming back to the Health and Wellbeing Board with further developments in due course. Before I hand over to Danny and Mark, could I just say, Chair, that I will have to leave at 12:30, if you'll excuse me. Thank you.
Thank you. And now Danny Plowman, please. Yeah. Is that right? Yeah.
We're actually doing a double act, myself and Mark.
Mark Dow. Well, you arrange it between yourselves.
Yes, yeah.
Mark
just,
Dow, Danny Plowman.
Thank you, Chair. Just introduce ourselves and then we'll do our deep dive overview. So I'm Danny Plowman. I'm one of the consultants in public health at the County Council. I lead on drugs and alcohol and inclusion health.
Good morning, everyone. I'm Mark Dow. I'm the Strategic Housing Lead for the County Council based in Adults and Commissioning, and as you see in the papers, I'm the Vice Chair of this delivery group to Councillor Jupp. I'll do the first little bit, just taking us through some of the overarching drivers for this piece of work, and then Danny will take us through the Year 1 action plan. Some of the drivers for this, Councillor Jupp has covered, but our overarching ambition is to improve the health and well-being of people living in temporary accommodation across the county, including access to health and care services. I think it's fairly well documented, and there's been quite a lot of reports published over the years that prolonged periods in temporary accommodation can have an adverse impact on those households and particularly the children contained within them, including such things as obviously increased non-attendance at school, increased attendance at primary care services, and potentially even affecting lifelong attainment. So it is obviously a key driver for this group. And the number of adults and children in temporary accommodation is rising in West Sussex. I think everyone is aware it's nationally as well, and the wait for longer term accommodation can be lengthy. And the last nationally published figures, March 2025, there were 762 households in temporary accommodation in West Sussex, and within those households, 751 children. And this has been an upward trend. I did attend an earlier iteration of this board in 2018, and my opening statement was 671 households in temporary accommodation in West Sussex, and that was the highest that we'd ever seen it at that time. So it is a gradually upward trajectory. I think it's also pertinent to say that not all temporary accommodation is bad or of a poor standard. A lot of temporary accommodation that the district and boroughs have housing services doing is of a good standard. But there are obviously other areas which are more along the lines of emergency accommodation, where you can have shared facilities, other households you don't know, potentially placed out of the area. And that obviously puts greater challenges on those households, particularly if you're away from your local support networks, your schools and your primary care services. As Councillor Jupp said, we had our inaugural meeting with the delivery group in September, then our second meeting in November, and our next meeting is scheduled for 26th of February. We have quarterly meetings, but with potential for any ad hoc meetings if there are any subjects that we feel need to bring the group back together again. And we've brought together slightly different approach rather than just giving updates. We wanted the delivery group, to be a very active and participatory. So as well as the updates of the work plan that we give, each meeting we have a workshop discussion on a particular issue of challenge or a wicked issue, so we can actually draw on the expertise and the talent of the people that have actually contributing time to this piece of work. And at the next meeting in February, it's anchor institutions. What more can our organisations as anchor institutions do to support people living in temporary accommodation? Membership, as I say, we've tried to make it as broad and as useful as possible. Councillor Jupp, the chair, myself as the vice chair, and the consultant in public health lead is Danny Plowman. And we've got membership from Adult Services, Public Health and Communities Directorates, District and Borough Councils, the voluntary sector, NHS, homeless charities, Healthwatch, West Sussex, Department of Health and Social Care, and the Temporary Accommodation Action Group, which operates in the county. Also alongside that, we are developing a lived experience advisory group, because we think it is very key to have people who have had lived experience or are having experienced to be able to contribute, feed in their experiences and contribute to this piece of work. We're developing that using one of the resources from the Changing Futures programme that has done a lot of work around involvement of lived experience, and as that group is forming, we will then be consulting with them on how they want to be represented at the delivery group. We think it's very key that they get to choose how they engage, because your sort of traditional format of a sort of committee room does not suit everybody. So that is something we will be developing over the next couple of months. That's my overarching introduction. Danny will take us through the year's action plan.
Thank you, Mark. A bit of an overview now of our action plan. As my colleague said, you will receive a copy of this to review virtually, but it'd be great to get your thoughts on this today. So, as Mark identified, our ambition is that the health and wellbeing of those in temporary accommodation will be improved. We've identified 4 key action areas to focus on in year 1. So Firstly, improving the data and intelligence around the needs and experiences of this group, and very importantly, subgroups within this population. So we know that the needs and experiences of a single person with multiple compound need living in temporary accommodation will be very different to that of a family placed in temporary accommodation out of area, for example. So we're really looking to kind of build that understanding of the differences within this population. Secondly, supporting the workforce, particularly as the needs and experiences of this group perhaps are getting more complex, making sure that we've got a workforce across both housing and health and care sector to support this group. Thirdly, improving access to services and support. And lastly, supporting transition to move on or permanent accommodation. We've agreed as a delivery group that in year one, our main focus will be around action area 1, improving data and intelligence, which will largely inform the key action areas 2 to 4 in future years of the delivery group. Next slide, please. Thank you. So that's probably a little bit small. So just to go through these key action areas as they're drafted currently. So firstly, as I said, improving data and intelligence. So this aims to improve our understanding of the needs and experiences of those living in temporary accommodation, including those subgroups. So the key action here, a big piece of work we're undertaking, is delivering on a West Sussex homelessness, health and wellbeing needs assessment, which does consider broader homeless populations, but a very key group within that are those living in temporary accommodation. Secondly, supporting the workforce. So key here is to ensure that professionals from across sectors, so housing and health and care staff, that are working with people living in temporary accommodation have the confidence, skills and training to support this group. So there's a few actions we're undertaking here, and there'll probably be more that come out of the needs assessment, but initially we're developing an e-training package for housing professionals that specifically focuses on substance use, mental health and trauma-informed approaches. The content of that has been drafted with both housing professionals and people with lived experience of homelessness feeding into that, and we'll be looking to get that on our learning and development platform later this year. Secondly, developing resources to raise awareness of local homelessness systems and support for health and care professionals, so really building their understanding of the housing and homelessness systems, and we're working closely with colleagues in Crawley on that who've already done a lot of work on that, very much leading the way and looking at what we might want to offer a county level. And lastly here, promoting suicide prevention in the context of domestic abuse training to housing professionals. Next slide, please. So in terms of that third key action area, improving access to services and support, we're looking to establish improved access to health, wellbeing and wider services and support for those living in temporary accommodation. So the first action here is implementing a temporary accommodation information guide across all areas. And again, that's building on great work and success that Crawley have had in implementing an information resource for people that are living in temporary accommodation in their area. Secondly, looking to explore opportunities to improve information sharing between key agencies when an individual or a family is placed in temporary accommodation. And interestingly, that's a new duty that will be coming into play nationally that's listed in the National Plan to End Homelessness. So a new duty that will ask councils to notify schools, health visitors and GPs that a child is in temporary accommodation. And thirdly, looking at mapping out existing good practice and possible opportunities as anchor institutions that are sitting on the delivery group to support those in temporary accommodation. And as Mark said, we're having a bit of a workshop style discussion on that in February. And the last key action area is around supporting transition to move on or permanent accommodation. We know that that can be a particularly risky time, especially for some groups that are placed in temporary accommodation in terms of their health and wellbeing, but also sort of that risk of repeat homelessness. So that's a key area of focus. And in year one, specifically looking at transition protocols for high-risk groups with an initial focus on overdose prevention. Next slide, please. So as I mentioned, the sort of key project that's going to underpin our work going forwards for the full 5 years of the strategy is the Homelessness, Health and Wellbeing Needs Assessment. So I thought I'd give it a brief overview of that for information. So the aim of this project is to assess the current housing, health and wellbeing needs of people who are experiencing homelessness, including those in temporary accommodation, in West Sussex and how those needs are currently being met, and we'll be using a mixed methods approach for that. So it's quite a standard way that we approach our needs assessment. So we'll be undertaking an epidemiological assessment of need. So that will be looking at the quantitative data, collecting and analysing that through sort of existing data resources available, and also any sort of bespoke data collection that we can undertake. Secondly, we'll be looking at comparison of needs. So how do we compare to other areas in terms of prevalence of homelessness trends, nature of homelessness, as well as the health and wellbeing needs of this group. And lastly, something we call corporate insight, but essentially engaging with professional stakeholders that work to support this population group, and we'll be taking a co-production approach to engaging with people with lived experience of homelessness. Next slide, please. And just an overview of kind of where we're up to with that project. So we've engaged with a really wide range of partners to define the scope of the needs assessment. That also included some pre-engagement work with around 50 professionals to understand their experiences of supporting people experiencing homelessness. So they were very wide ranging from, housing professionals, health and care professionals, voluntary sector, very wide range of professionals that we have spoken to. We've convened a multi-agency steering group to oversee the design, delivery and dissemination of the needs assessment. We've established, as Mark said, a lived experience advisory group that have approved the scope, and they're now working to develop bespoke data collection for people with lived experience of homelessness, initially through a survey. We've agreed that scope and we've mapped existing data sources and made requests to access that data from a wide range of partners. Thank you. So in terms of next steps for our delivery group, as we've said, we've got our next meeting on the 26th of February. We'll be progressing and monitoring this action plan, obviously, after this plan's been signed off by the board. We're developing our delivery group engagement plans, specifically thinking about LCNs and ICTs and wider stakeholders. It's a very busy space and there's a lot of local work underway, so we very much want to build on and support that rather than duplicate. We'll be completing the West Sussex Homelessness, Health and Wellbeing Needs Assessment. That should be in the summer, and that will very much inform the other key action areas within the delivery group plan, and of course be providing regular progress updates to the Health and Wellbeing Board. I think that's it for us, so very happy to answer any questions or take any comments on that.
Thank you, Mark and Danny, and of course, we got the general update on all 5 priority areas, but particularly if there's any questions on or comments on the temporary accommodation delivery group. Lois Hale, please.
Thank you. I'll get in touch with you outside of the meeting. Thank you.
Thank you for that. And any other comments or questions? And Monica Fletcher, please.
Well, first of all, I'd like to thank you, Councillor Jupp, for getting behind this, because I think, sitting here as a resident of West Sussex, as well as my professional hat, I'm quite surprised by the numbers. I think the numbers are quite disturbing. So thank you, and thank you for the team for what you've presented. I put my other hat on outside of here. I'm a researcher at Oxford University, and so my head goes into trends. And I know you spoke about, what it was like. I'd like to see actually what it's been like for the last few years. And you're doing some fantastic work, or will be doing some fantastic work, but I'm also interested in the root cause analysis as to why this has happened, what are the critical things that have happened to have got us to this position. So just a little bit about when you're looking at the data. I mean, I know you're beginning to collect this data, but if there's a little bit more that we could be doing, that might be helpful for certainly for me, to see where we're going, and is there any prediction about anything else that might change it, and is this going to potentially get worse? I mean, sometimes it's because we're much better at identifying, so I don't think having the numbers and the numbers going up necessarily is always a bad thing, because if schools and other points of identification do pick people up earlier, your numbers will go up. So I don't want the board to think, well, suddenly we have an increase, but it might be that the reporting is actually better. And I just wanted to make a link back to the work that's being done on safeguarding, obviously for children. I think education have a real big role in this, and families don't always want to, or they tell their children. I also have been a health visitor, not to tell people that they're sleeping on somebody's sofa because they're afraid that the authorities might intervene. I mean, it's just the life in which sometimes we live in. So it's actually that hidden elements and those points of contact that particularly children have, as in schools, they have a big role to play. So sorry, a long ramble, but I hope that made sense.
We could talk for the rest of the day and the rest of the meeting about the drivers of homelessness and the housing situation, but perhaps we can pull some general things back around some of the themes and the highlights which we can feed back, and if the wider group would like to receive that as well. But it is a very, very big subject with multiple facets that are influencing the housing situation in the county.
Thank you. Colette Visage.
Thank you very much. I think Monica kind of stole my thunder a little bit. I just don't know if I've missed it, but when I looked at the membership, I do not see children's social care as part of that. And I think it's really important taking into education is part of our directorate. So Mark, and Danny, if there is opportunity for us to be more aligned within the membership, that would be really helpful. Okay.
Do you want to think of somebody, Colette, and I'll get in touch?
I will do that.
Fozia Harrington, please.
Thank you. Thank you for the presentation. It's really helpful to see. I know there's a lot of work going on with our LCNs around this, so it's really pleased to see how you're linking in with them and taking the work that's happening in Crawley, especially into account. So that's really helpful. My comment was more broader, not just about the temporary accommodation work, but all the work streams. So it might be a question for Alison rather than around the temporary accommodation. There's a couple of questions. I was just wondering, in terms of looking at the data, how potentially the action plans will be looking at how we target our efforts in terms of where there is greatest need, for example, and whether our delivery groups are considering that, or whether that's too early days at this stage, because I think that is something that we really need to press on in terms of, whilst having a West Sussex perspective, how does that really play out in terms of supporting our health inequalities and addressing those?
Thank you, Fozia. Yeah, so I think that absolutely all of the delivery groups, I know that they're very focused on focusing their areas into the highest areas of need. As you say, we're collating the delivery group action plans at the moment, and we'll be doing that assurance and checking in a helpful way as a critical friend, but hopefully delivery groups will find that helpful. We'll be having conversation as well, so we'll be doing the assurance and the support too on that.
Thank you. That would be really helpful to see, because then we can also see how our neighbourhood teams or our integrated community teams can support in some of that delivery as well, if we know we're targeting specific areas on some of those actions.
Ian Tuke, please.
Yeah, thank you. It's I think with my kind of West Sussex housing hat on, and that's starting to expand into a more Sussex-wide conversations at the moment. I think we really welcome the delivery group on this, and I think towards the end, what will be fascinating is coming back to Monica's point is kind of those drivers. So if we go back to the work that came through on deaths by suicide within temporary accommodation, there was actually clear health drivers around mental health and substance misuse in the majority of those cases coming through. So it's kind of what it tells us about the prevention agenda. I think with, the danger is we only try to put the health prevention in once people are in temporary accommodation and not necessarily recognising the health drivers that get people into temporary accommodation in the first place. So it's the right focus for now, but towards the end, I think a shift to what we can do from a preventative standpoint would be really, really useful.
Yeah, thanks, Ian. That's certainly a focus of the needs assessment. There'll be a large section around the drivers, contextual changes. And to come back to your point, Monica, we will be looking to try and model how that population looks going forwards as far as we can with the data available. Yeah.
Okay, thank you, Chair. And thanks for the presentation. It's really good to have some of the detail that has been started already, and just bearing in mind these delivery groups have sometimes only met for a couple of times already. I think the pace of work is really good. I wanted to come back on one of the points that was mentioned that you're scheduling for your February group around what can anchor institutions do to help this specific work. And I think that's a very important conversation to have, and probably something that we'll need to hear back into this board space. And the reason for saying that also is that underpinning the 5 priorities for the health and wellbeing strategy, we have 3 principles. One of those principles, although we're not naming it anchor institutions, it is very much how we learn from one another as organisations to progress both the work of the strategy but also the work of the board more generally. So I'm very aware that a lot of organisations are progressing anchor institutions work within their own sphere of work. The difference here might be that we can bring that together and learn from each other and think about where we go next with it. So whereas that's an important conversation for temporary accommodation, health in temporary accommodation, it's also a broader conversation that I think we as a board would benefit from across all the priorities, but also as a board. So I think this is something we will come back to. But I'm very interested to hear how that debate goes, whether you're actually able to open that out to other members that might be interested in that thinking, and we'll catch up in terms of how we bring some of that understanding back in to the board. Thank you.
Thanks, Alison. Can I see if there are any other comments or questions, please, at this stage? Anything online? No. Thanks for all those useful comments. I'll just summarise some of them. How it's important to involve a number of different sectors, like the hospice sector, education, and also ensure on the temporary accommodation delivery group we've got children's social care representation. The focusing of effort into the areas of highest need, how the integrated community teams agenda might support that, and also how the health drivers themselves can sometimes lead to a need for temporary accommodation, and therefore a focus on prevention in that area. So at the outset, I read what we're asked to do, just continue our partnership work and approve the delivery group year 1 plans. So if we can watch out for those plans, action plans are being published for virtual approval, that would be appreciated. And thanks very much to Mark and to Danny for your work in your presentations today. So I'm moving now to item 11, which is the Healthwatch annual report tabled from pages 113 to 144. And I'm going to ask Jo Tuck, volunteering lead and deputy manager for Healthwatch, to present this report, please. Jo.
Thank you, Chair. I'd like to thank you and the board for giving us this opportunity to share some of our work. Our team are so busy doing the work that we don't often get a chance to pause and reflect on our achievements and the impact that we have. So we welcome this opportunity to give you an update. I'd like the board members to note that the report I'm presenting is the April 24 to March 25 report. So we're already 3/4 of the way through the next year. and already starting to think about 26 to 27. There is also a short video that we've been able to produce which we've published publicly to showcase our work from 24-25, and I think the link to that will be shared with the minutes. Thank you, Rachel. So just to summarise some of the key achievements in the report, which I'm sure you've all seen, so I don't want to bore you with duplicated facts and figures, but I think some of the highlights that I wanted to just bring to your attention, in respect of how we engage and listen to local people, we had 15,746 local people shared their experiences with us in the year 24-25. 992 local people came to ask for advice and information through our help desk. We published 25 newsletters and bulletins giving information to local people about health and care, service changes and improvements, and over 400 social media posts which have a reach of tens of thousands of people both within West Sussex and beyond our county borders. We published 32 reports in that year covering the improvements that people would like to see in health and social care and some of the impact of our work. Interestingly, our most popular reports have been our Enter and View report following our visit to Southlands Hospital in Shoreham, which included a deep dive into patient experience at the then new Community Diagnostic Centre. Some of our other highlighted reports that I'd like to mention are the Cancer Care Review that we were involved in, and we also did quite a large piece of work with Crawley LCN looking at barriers to accessing healthcare support when homeless, which feeds into the work that Mark and Danny have been talking about earlier. I wanted to just remind the board that we are very lucky to have local people that support the delivery of the work that we do. And we have 65 dedicated volunteers who in the year 24-25 gave up nearly 2,000 hours of their time to support the work that Healthwatch delivers. We only have a very small team of 7 paid staff, 4 of whom deliver the Healthwatch functions and 3 of whom deliver the independent health complaints advocacy service, supporting local people to make formal complaints to the NHS. Some of our most impactful projects, I feel, for the year were building strong partnerships with South Downs National Park. Hopefully you've all seen that report. This was a joint project with South Downs National Park and Sussex Community Transport, which helped to secure a health and wellbeing travel grant connecting communities with the outdoor spaces to enhance and promote physical and emotional health and wellbeing. And as I already mentioned, and connected to the work that Mark and Danny are doing, we partner with Crawley Local Community Network to conduct a survey on the experiences of people in temporary accommodation, which resulted in a very comprehensive report with actionable recommendations for meaningful change. And this is feeding into ongoing work within Crawley LCN and the ICB and the county. Thinking about our future work, so as I mentioned, we're already 3/4 of the way through our current year and starting to think about the year 26-27. Our current core areas of focus are healthcare, in particular access to accurate and trusted sources of information and advice for local people. We look at primary care, and that's not just our GP and services, but also pharmacy, optometry and dentistry services. We are involved in pieces of work looking at secondary care, so inpatient services, outpatient services, discharge and palliative care services. And not to forget the very important adult social care element of our role. And some of the work that we are currently looking at is involved in hospital discharge pathways for local people. And of course, we are up front and centre in the development of our integrated care teams across the different neighbourhoods. I wanted to finish this update to just ask that the board joins us in acknowledging and being mindful that due to proposed legislative changes, the functions of Healthwatch England and local Healthwatch will transfer to new systems and partners in 2027. However, we are pleased to say that our funding has been confirmed for the year 26-27, and until such time that legislation changes, we remain committed to delivering our statutory functions and providing a quality service to our local health and care system and to the people of West Sussex. Thank you.
Yeah, thanks very much for that update, Jo, and thanks for all the work that you do in Healthwatch, and including your volunteers. It's great to hear that you've got so many. And on the last point that you make, I express the hope, and it might be hope more than reality, that whatever happens, that somehow there is retained an independent voice for customers, for patients, and not specifically aligned to any particular part of the system, but we shall see. And so we're asked to note the annual report and update, reflect on the added value that Healthwatch provides, and offer any suggestions for areas of focus, joint work or collaboration for 2026-27, recognising the proposed legislative changes. So I invite board members to comment and ask questions. Anyone? Emily King, please.
Thank you. It was a really enjoyable read. I think it's something that brings real joy, doesn't it, to see that voice is really being reflected. And certainly I know that there are huge opportunities that we've perhaps not explored. So I guess I had a question in terms of what do you need, want, would like from us. But I particularly was really minded to think about our changing population. So I know in terms of one of the areas of focus for the kind of the year ahead, I think the connections you've already made across the health and wellbeing programme, I think, but for me there is something about those communities for whom English isn't their first language, and whether there is more or something that we could do that perhaps is a bit more of a focus piece, maybe building off some of the priorities that we already have in the Health and Wellbeing Board plan, to see whether there is additional work that we could do. And I really recognise that we had the opportunity this year to participate in Op Pegasus, and for many of us that meant we got to kind of relive some of our COVID experience. And I think there were things that we developed and delivered during COVID that were really powerful in terms of community champions, in terms of using people from within communities to really speak and connect. And I wonder whether there is something about taking some of those experiences, particularly connecting around the LCNs, but then I'm particularly keen to think about whether there's something that we can do collaboratively for those communities for whom either they're new into West Sussex or that they may be finding it additionally difficult and challenging to navigate our systems. And I'm aware that we're in Crawley today, and Crawley is one of those locations that certainly has a really diverse population. So I'd be really keen to pick a conversation up outside of here to look at how we might be able to work together to come up with something that feels like a bespoke piece of work, but that would benefit the wider health and wellbeing system.
Thank you. That's really, really useful, and absolutely we'd love to connect outside of the meeting and see how and where we can work together. Going forward, we're thinking very much about, as it's likely to be our last year of being Healthwatch, the year 26-27, we're thinking very much about the inequalities and inclusion element of the work that we do. So we want a big focus on that, bearing in mind the massive change and transformation that is happening within our health and care system. And not forgetting that it's the local people that we need to support and represent whilst all this change is taking place. Thank you.
Thank you for that. Are there any further comments or questions, please? No? Okay. Well, thanks again for the report, and we support your activities in that next year as well. So we'll move on to item 12, which is the integrated care system update tabled on pages 145 to 148, and I invite Fozia Harrington to present, please.
Thank you. I'll hand over to Mon first, and then I think we might do a bit of a double act.
Okay.
Thank you, Fozia. I just felt it would be appropriate for me to just set a bit of a context strategically and to introduce the rest of the paper. So just to start off with a transition update. Those of you that don't know me, I was a non-exec director of NHS Sussex, and I've become part of the new board and have become deputy chair of the combined ICBs of Sussex and Surrey. I am a Sussex resident. I will keep a very strong eye on everything happening in Sussex, as will the rest of the board. So I know there are concerns about the geography and what's happening there. I just felt it would be appropriate that I sort of set the scene. And first of all, I want to thank you to all the partners that have actually come up to me, and I'm sure they have done to Fozia, saying it must be very difficult. I know you're all very much aware of the position we're in, and I just wanted to commend Fozia and other members of staff who have been so professional through this amazing change. And Fozia is just one of many people who are having to go through this experience. Just to catch up, you know that it was March last year that the government made this decision, that this was all about, and quite rightly, we don't want to duplicate roles, we want to see where there are savings in public money. The decision was made that we would go through the route where we've gone to. The result of that is that we have to make really about 50% of our staff have to leave the organisation. So where we are at the moment is that the chair and the non-execs were appointed, the executive and the executives have been appointed. Now the structures are all being agreed. We are out for consultation soon. We've had a MARS scheme, so a mutually agreed resignation scheme first. We've had voluntary redundancy. We've reopened voluntary redundancy for a period of time. That's closed again, and now we're going for compulsory redundancy. I just want to share with the board, though, that once more, that the professionalism within our staff, we are continuing. Amazingly across the two landscapes, people are sickness leaves. Sickness has not really escalated. I just showed that as one indicator of how our staff are working. We hope we will come through this pretty soon. It feels like, you know, this has been a long journey. And as I say, we have people's livelihoods and obviously the population. It is important we carry on doing our work. Also, the role of the ICB is changing rapidly, and we are looking now and really looking to, if we look to the future, strategic commissioning and population health is a very exciting place for us to be, and to align with Alison and other colleagues around here, thinking of public health and other partners in the future. It will be absolutely a good thing, but at the moment, please bear with us. And and I just wanted to set that context. So thank you all very much for listening to me, and over to you, Fozia.
Thank you. So BAU, back to business. So just moving on to planning. So we have received the National Medium-Term Planning Framework, which covers 26-27 through to 28-29. So it kind of represents a shift away, the traditional look at annual planning cycles, which is really helpful, towards more of a rolling 5-year planning cycle. The framework sets out really ambitious goals, as you would imagine, and things that won't be a surprise in terms of urgent emergency care, cancer, waiting times, primary and community services, and mental health. It emphasises that that digital is really important in terms of how we make some of these significant changes over the coming years. We are working towards, there's a significant amount of work going on within the ICB and with partners and providers across Sussex and Surrey. It will set out the actions required to improve health outcomes and will align with, obviously, our local health and wellbeing strategies. Work's also underway with regards to the strategic 5-year plan, and it builds on our strategy that we have already, and it builds on the Health and Wellbeing Board strategies. What will be different is kind of the next phase of those strategies, but builds on a collective view around Surrey and Sussex. timescales for that development has been really tight. So I think the ask was not out in December, and we have a first draft required for mid-February. So engagement hasn't been wouldn't have been as well as we would have liked given those timescales. But the reassurance is that it's the journey continues from where we are, and there are no significant changes that we'll be expecting to see around that. Neighbourhoods will be really key in that, in terms of not only kind of where we've been focusing some of our efforts in terms of highest and ongoing needs, but throughout the populations, whatever their level of need, whether that's urgent emergency care or that ongoing need. So moving on to sort of where we are currently, and I think Alison mentioned it earlier around our sort of winter pressures, like we are seeing nationally, the system is operating under significant strain and stress and demand for this time of the year. We do have our winter plan, which is coordinated and pulled together for the system, which we are implementing, and we will we are working through that. There is a strong emphasis, and Alison mentioned, around the vaccination uptakes, urgent emergency care and mental health support. Vaccination uptake across Sussex remains slightly lower than the regional average, but above the national ones. And in West Sussex, we are seeing slightly better performance across than other colleagues across Sussex. So staff do remain working tirelessly to in this context, and it is a really demanding time of year. So our thanks go out to all the staff that maintain that and working in this environment. But I will pause there and happy to take any questions if there are any.
Thank you very much, both, for your presentations. And can I just see if there are any questions or observations from anyone, please? Yep, Anushka Adamson-Parks, please.
Thank you. More an observation, really, and to put a little bit of context to that ambitious time frame, because, of course, all providers within the system are having to undertake this planning process. And I just thought it was worth highlighting that actually one of the things that's really different from this year's planning round is the articulation of 3 to 5 year plans, and particularly those first 3 years. They are going to be backed by numbers, so it's not just strategic narrative. And I think that what that's really made us think about is how ambitious we need and the pace that we need to deliver some of our transformational change, because our do-nothing position, the status quo, does not deliver a financially sustainable NHS for the future. And I think that Fozzie has talked about the neighbourhoods, and we know that they are going to be a critical enabler for changing how we deliver healthcare and supporting the prevention piece that's also been outlined earlier in the conversation. But the scale of change that's required is quite significant, and I thought it would be worth just hammering that bit home, because it is going to be quite a change, I think, over the next few years.
Thanks for your comments. And significant is an understatement, in fact, isn't it? Really, I mean, it's a massive change, and we're talking about the Integrated Care Board having to operate on a budget, I think, of £19.40 per head of population, which is a major shift from the previous levels of funding available. And major is an understatement as well, I think. So, yeah, full respect for all of the efforts all of you are having to go through and you're making to make this enormous transformation. I'm sure I speak on behalf of the entire board when saying that, and I'd like to record that in the minutes, and the professionalism that you're all showing under really quite extreme circumstances. And although we all desire value for public money, this particular initiative, I think, was something of a surprise, given that the integrated care boards themselves and the integrated care systems are not long established. They were established under the previous government, I think 42 of them for England, and that number is clearly reducing. So I think you surely have the full support of the Health and Wellbeing Board in all the efforts that you're undertaking. Can I see if there are any other comments or questions, please? Jo Tuck.
Sorry, just a quick question about something quite specific. We were quite disappointed to see the COVID and flu vaccination uptake this year. And I just wondered if there's any, and I know the system is so busy, but is there any way of trying to understand why that is? And are there any plans to try and encourage more people to take up those vaccinations going forward?
Thank you. That's a helpful question. So yes, we continually look at how we're performing and how we can potentially improve that performance, and that's kind of an ongoing piece of discussion. And certainly at the end, there will be a bigger review to help us inform plans going forward for next year and to take the learning as well. So we always welcome feedback from others in terms of what is being seen around the system. So if there is any further support around that, that would be really helpful.
Sorry, just wanted to say, if Healthwatch can support that in any way, we would be really pleased to support that engagement with the public on understanding why there's been a lower uptake, and perhaps encouraging more people to take up the vaccines.
Thank you. And Alan Sinclair, please.
Yeah, thank you both for the report. And it's significant, you're right, Bob, it's not a big enough word, is it, really, to describe all the changes that are going across the NHS. And then if you add into that the changes that are about to come for local government, we're in an interesting place, everybody, aren't we, in terms of how we manage to meet the needs of our residents and patients as we move forward. So I think the conversations are really critical. They continue. We keep having the jointness. I think a focus on neighbourhood. I think we're all really keen to get to that point. But it is hard, isn't it, to work out, with all the change going on, what is it we're going to be doing that's going to make the difference to our residents and patients. So just a statement, really, from my point of view. I suppose the question from me is, and I know it's one that I probably raised with Ian previously as the chair of Sussex and ICB. Obviously, the concern we all have is moving to a merged Sussex and Surrey and Sussex ICB. That sort of loss of focus for Sussex. Obviously, we were all partners in developing the Improving Lives Together strategy, which I think we were all really proud of getting into place. And where does that go? What happens to all the ambition there as we merge? And Monica, I'm really pleased that you are going to be taking over. You're taking over as the deputy chair, because obviously you bring us Sussex focus, but obviously making sure we are Sussex, aren't we? And we want to make sure that Sussex continues to get the focus it needs out of an ICB that it was getting previously, and we want that to continue. Thank you.
Come back briefly, and please do not worry about that. We will remain very much Sussex as part of Sussex and Surrey, and equally our counterparts in Surrey are concerned. And they've got even more turmoil at the moment in their local authorities and what's going on there. So plans are the same, neighbourhoods where we're going forward, discussions that we've had about reviewing services, the integration, the work that's been done before. I mean, I'm lucky enough to have been part of Stephen's team, his ethos I carry forward. Instead of saying what he would always say at one of these meetings, 1.6 million population, we've now got 3.1 million population. I mean, that's the size and scale. We're doing a lot of work at looking at indices about comparing the populations, very different. I won't go into that now, but the populations are quite different. And it's obvious where the greatest need is. It remains in Sussex. So we will take that forward into our thinking and our planning in the future. But yes, we are really very much still focused on Sussex. So thank you. And thank you for your support, everybody.
Thank you. Are there any other comments or questions? I'll just go back to something Jo Tuck raised around vaccination. And I mean, vaccination is one element of prevention, deferral and moderation of demand. But there are others, and I do think the budgetary position that the NHS finds itself in our part of the world makes the case even more strongly for prevention. I just think that's an important point to make. So thanks to our NHS colleagues and for presenting this item. And we're asked to note the report, and I think we've all expressed our support as well. So let's please move to item 13, which is the Better Care Fund report, pages 149 to 158. And Fozia Harrington, please.
Thank you. And again, I might do a double act, this time with Alan. So I'll start. This is just our standard report in terms of our quarterly reporting against the Better Care Fund. We are just in the throes of finalising quarter 3. Timing didn't quite work for us. So it sets out the position in terms of quarter 2. It's worth reflecting and reminding members that the BCF is just one small part of the delivery of the metrics, and there's a huge amount of effort that goes on across the system with all partners in terms of trying to deliver those metrics. For 26-27, we are awaiting the planning guidance, which is now due out in February, I believe, following a little delay. It is expected that the BCF will be replaced by a new framework called Integrated Care Funding Framework. So we better get used to that acronym instead. And the focus will remain on integrated working, as is now across the system, and for that reason, it will be far more integrated and integral to supporting neighbourhood plans. And as part of the expected BCF guidance, and we're expecting also neighbourhood health guidance, and we'll likely to see an expected strengthening of the role around the health and wellbeing and the development of those neighbourhood plans and the BCF. We don't expect 26-27 for there to be significant change, but a transition year to 27-28, and we'll wait to see what those expectations are in that guidance. So I'll pause there and see if Alan wants to add anything.
I think you've covered everything I was going to say, Fozia, so that's fine.
Right, thank you, Fozia. Can I just see if there are any comments or questions on this report, please? No? Well, we're asked to note the requirements and timing of the Better Care Fund quarter 3 return 2025 to 26, and to note the West Sussex performance against the National Better Care Fund metrics as at quarter 2 2025-26, tabled in Appendix A, and note the planning position for 2026-27 and the confirmed uplift to the NHS minimum contribution to adult social care related spend for 2026-27. Is that agreed? Is that okay? Yeah. Right, then we go to the Health and Wellbeing Board Work Programme for 2026-27. Pages 159 to 160. And you can see the tabled meetings, and the next one being in May. And I just mentioned that, as we discussed earlier, we've got a steering group that's been set up with myself as chair and lead officer Alison Challenger, also executive director of communities Emily King, and we have a voluntary sector rep in Jess Sumner, and we have Ian Duke representing the district and borough councils, NHS represented by Fozia Harrington, and Healthwatch represented by Joe Tuck. Are there any comments or questions on the work programme that we have, please. Lois Howe.
Thank you, Chair.
I mean, that's something I'll table with the group and see if we can include that.
Yeah.
Sure. Yeah. Okay, there's no other comments there. So the item 15 is the date of next meeting, which is 14th of May 2026, 10:30 a.m. Venue to be advised. So with that, I thank everyone for their attendance and contributions today to the Health and Wellbeing Board, and declare the meeting closed. Thank you. Just give a little moment for the webcast to turn off.